I really appreciate it. I'm grateful for being here today. This is I love the setup of this. One of the reasons I even wanted to attend this is because I wanted to see how this is actually in operation so that we could try to replicate something in Nebraska. And so I've been working on how climate has been impacting our environment and impacting our health for a long time. I originally got started working at NOAA, the National Oceanic and Atmospheric Administration. And then from NOAA, I started working at CDC in a joint role between NOAA and CDC. And at CDC, I was working within the Climate and Health Program within the National Center for Environmental Health. And I've been interested in climate change for my entire career. But one of the things that I became really interested in while I was working at NOAA and while I was working at CDC is the impacts of drought on human health. And the reason for that was, and the reason that I saw that there was a definite gap in our knowledge around this was when I was at CDC, two things happened kind of simultaneously. One, I was asked to be one of the lead authors on this national assessment that was being led by the US GCRP, the Global Change Research Program. And with this national assessment, I was asked if I could lead the chapter that was going to be focused on how climate impacts extreme weather events and how that impacts human health. And very quickly, as we were going through all the literature and all the resources, I noticed that there was a major gap in our knowledge. And that gap was around drought. And I'll talk about that in a little bit. And one of the things that we've been trying to do is build our information and understanding around this. Two, at that exact same time, in South Africa, Cape Town was going to what they were going to call zero water, or it's kind of like a breakdown where they were running out of water for their city. And this is where I realized that this wasn't just a gap in knowledge in the United States, this was a gap in knowledge internationally. Because working in my joint role between NOAA and CDC, we have connections to the international community. And people from the World Meteorological Organization and people from the World Health Organization simultaneously were reaching out very broadly, asking for materials because they were like, if we run out of water in South Africa, there is a very great impact, or immediate impact that's going to happen on the health of all the individuals living here. And there weren't materials. Because I was getting information coming in from two different channels internationally, being like, what do we have that we can work with to communicate to our populations? And so with understanding that that gap existed, that got me interested in trying to better understand these relationships. So we've got our learning objectives that we're going to be covering over today. I'll throw those up there. I won't go through those in depth. But drought is an ever-present problem in the United States. This is the most recent drought map for the US. And as you can see up in Montana, we have drought that's present currently. And we have drought present all across the US, even where I'm at in Nebraska. And that we know that these conditions will continue to persist. The dark brown is where drought will persist over this next season, next few months. And the light brown is where that kind of tan color is where it's likely to develop. And so we're going to see continuation of drought events, especially in this part of the country. So that's our current and near close or near future impacts of drought, or where we're seeing drought. But we have good historical climate records for the United States. And one of the things, we know that a lot of our extreme weather and climate events have been changing across the US over the last 50 to 100 years. Some places are getting wetter, some places are seeing more frequent storms, temperatures are rising, as we're all quite well aware of. But we're also seeing shifts where some places are getting drier. in the western part of the United States is one of those areas. We're seeing more droughts in the western part of the US, drier conditions. With that, we're also seeing more wildfires and more warm, hot heat waves. And not only are we seeing these changes, they're having impacts on our economy as well. So this is out of NOAA. This is where I used to work in Asheville, North Carolina. There's the National Center for Environmental Information. It used to be called the National Climatic Data Center. And since 1980 moving forward, they've been estimating the economic impacts that different climate and weather related events are having on the United States. And so these are billion-dollar climate and weather related events. So these are events that when they occur, they exceed $1 billion of economic loss, monetary loss. Like I said, from 1980 moving forward to present. And one of the things that you'll notice, each of these, those bar graph that we see, is the number of events that are occurring. Now, previously, when I would give this talk and I would say, well, we look at it and everybody thinks of 2020, right? As a really bad year. And 2020 was a really bad year because of COVID, right? That's what a lot of us think of in the context. And so that was always my story. And then I would point at billion-dollar climate and weather-related disasters in the United States. And that was a record year. We had, I believe it was 22 or 23 billion-dollar climate and weather-related disasters that had significant impacts on the United States monetarily. It meant there was hurricanes, severe storms, people were displaced. In that same year, we had COVID. And I remember talking to healthcare professionals, and I'm not calling you out by any means. And people were like, hey, we can't talk about climate change. We've got COVID. And I'm like, climate, weather, our environment doesn't care. It's going to keep throwing things at you. And I talked about that and I said, 2020 was a really bad year. But then 2023 happened. And then that set a new record with $28 billion climate and weather related disasters across the United States. So these costs are increasing. The number of events are increasing as well. One of the things that I'll point out at the very bottom, it might be kind of hard to make out, but down here, each of these little brown spots on that plot is a drought event that occurred. That was a $1 billion climate or weather related event. Now, droughts, we don't get as many because droughts spread out over a really long and big area and have very significant impacts. Oh, thank you. So each of these right down here, as you'll see, there's a number of $1 billion climate or drought events that exceed $1 billion of economic loss. So that's what we're experiencing. That's our history. That's our near future. But moving forward, we understand the physics of this. We understand how our environment is changing. We're better understanding that. And one of the things that we're starting to see moving forward is that, or what we project moving forward, is that we're going to see more of these types of events, these drought events. Longer dry spells, longer periods where we're seeing more drought, especially in the western part of the United States. That's along with hotter temperatures as well. And so just kind of emphasize on it, when we talk about drought events and the impacts that they have in the United States, this might be kind of hard to see, but you have the little figures or the TV screens up in front of you. So when we're talking about total cost, as far as economic cost in the United States, droughts are number 2, I believe. Yeah, number 2 behind tropical cyclones as far as economic impact on the US. And this is the one that kind of surprised a lot of people, and it surprised me. When we're talking about the number of deaths attributed to weather and climate related disasters in the United States, and there's some missing pieces in this, and we'll go into that in a bit. Droughts are actually number 2 as well. Oh, no, wait, droughts are number 3, sorry. They're behind severe storms and tropical cyclones in total cost, but number 2 as far as deaths attributed to weather and climate related events. And when we look at that number of deaths, those are actually heat related deaths. And I'll talk about that in just a little bit as well. And there's pretty much no place in the United States that isn't impacted by droughts. This is where pretty much every state in the lower 48 has experienced a $1 billion drought event over the last 40 plus years. And you'll notice that Montana is shaded in as well. And so this kind of just setting the stage, understanding a little bit about the impacts of drought, where drought occurs, and also just telling you a little bit about the story of why I started to become interested in this. I put this quote up there because it was just such a powerful quote. It was about 15 years ago. I was at a conference. This woman from NOAA got up and she made this. I wish I could remember her name. I remember writing it down in my notes. And I was like, I'm keeping that one. And unfortunately, I didn't put her name down. So I wish I could give her credit. But she said, floods kill people, but droughts destroy civilizations. And I was like, oh, that's a good one. And so, and if you look back and you look back in time, you can see major drought events that have occurred and the potential fall of different civilizations from Central Asia or Central America, Asia, and Africa. And even here in the United States and the impacts that it had during the Dust Bowl of the 1930s. Although it wasn't the fall of our civilization, it definitely had significant impacts to the central part of the US. Internationally, droughts have likely led to more deaths than any other climate or weather related event. That's primarily due to famine and malnutrition. Not only that, as far as the number of people that are affected and are actually impacted by different climate or weather related events, droughts are number 2 behind flooding. It's because of the significance and the size of those particular events. But we don't always, especially here in the United States, think of drought in the context of human health. Drought, a lot of times, we think of it in the context of water resource management or agriculture. And the main reason for that is it's hard to understand that relationship between a drought event and a human health outcome. Droughts evolve slowly. They're not like a lot of other natural disasters or unnatural. And so there's not that immediate onset where you see those impacts like a hurricane when it hits that sends people to the hospital right away. So those impacts take longer to manifest. It can require multiple steps, delayed or slower impacts just in general. And health surveillance isn't designed to connect a drought event to human health outcome. You know, there's not an ICD code that you can put down that says, why is this person here today? It's because of a drought. And so because of all these potential limitations, it makes it hard for us to understand those relationships. But those relationships are there and they're very important. And I'll talk about them in a bit. And the way that I look at drought is similar to the way that I look at climate change. Climate change is a threat multiplier, right? Changing the environment that you live in, that change in environment can have a variety of different impacts in a number of different ways. In 2016, when we released the climate and health assessment, which was the first large assessment of looking at how climate change impacts human health, one of the things that we said was climate change is a significant threat to the health of the American people, and all populations are vulnerable to the health impacts associated with climate change. The reason we said that was when you look at all the ways that the climate is impacting the environment that we live in and will continue to impact the environment, there's just no way that anybody escapes that. Same thing when a drought event occurs. Droughts change everything around you, but you don't always see it. It's not easy to see like it is with a hurricane or some other natural disaster. Droughts can exacerbate heat waves. Hence, when we were talking about how it leads to, it's the number 2 leading cause of death with climate and weather related disasters. in the US. Droughts lead to conditions that are more ideal for wildfires. Droughts lead to conditions that reduce water quality and water availability. They can change air quality, and I'll talk about that in a bit. And then they can also change vector habitats, habitats of things that spread disease. Actually, I got to bring this up. So, does anybody know why in the United States we have such good records of climate, temperature, and precipitation, historical records?
Farmers only.
Farmers only? Oh, okay.
Is it the cicada cycle?
Any other guesses?
Grasshoppers and glaciers.
Grasshoppers and glaciers. These are all good. They're like good visual. But as far as like actual measurements where we have like a physical measurement, it's healthcare. Back in the early 1800s, the Surgeon General for the US Army directed all hospital surgeons to take temperature and precipitation measurements across the United States. Any ideas why that might be? Who said it? I heard it. Malaria. Malaria, yellow fever. At that point, we didn't understand that mosquitoes carried those diseases, but they could understand that when temperatures were warming throughout the year and precipitation patterns were changing, that there was outbreaks of disease within people living in communities and soldiers. It wasn't until much later that we actually understood that it was mosquitoes. And because of those measurements, that's the reason we have such a strong historical understanding of our climate and temperature here in the United States. And we understand the changes that we've been experiencing better than some other places. So just FYI, there's a connection with climate and our health that's existed for a really long time in the US and even further back. So when you look back over time, or you look back and you try to understand these relationships between drought and human health, it's complex. So you have drought events, and there's different ways that we define drought. I won't go into all those. It changes the environment in some way around us, whether it's dust storms, wildfires, changes in water quality and quantity, more intense heat waves, vector habitat and range changes, food security, water security. And then those things can lead to human health. But one of the points that I really want to make here is we need to understand the environmental and the social and behavioral context that we live in. If a drought event occurs in, let's say, Georgia, Montana, Nebraska, and Arizona, each of those, when that drought event manifests, is going to have different outcomes because of the people that live in those communities, the social determinants of health, when we're talking about healthcare, occupation of the individuals, is it more rural versus urban population? What is the race, literacy, age? What kind of discrimination do they face? And what is their access to caregivers? But then also on top of it, the environment. What is their water supply? What are the local environmental conditions? How prepared are they for drought events? Do they ever see them? Agricultural management practices, and then just basic infrastructure. And so understanding those really impacts what are the health outcomes. Those things impact what are the health outcomes, but understanding those can allow us for also to make mitigations within our communities to reduce the potential impacts when these types of events occur. And there are impacts. And so I always joke about this. This first paper that I have over on the left side was one of the first studies in the United States that was able to identify that with drought events in the western part of the United States, they saw an increase in mortality, especially in older adults. The reason I joke about it is everybody thought that I was the author on it, because the first author is Jesse Berman. The last author is Michelle Bell. And they just took the two names and they combined them, and everybody congratulated me on it. They're like, that's such an interest. And they knew I was working on drought related stuff. And so now I work with Jesse Berman on a number of different projects to further understand this, just because of that, how impressive that first article was to identify that there are human health impacts on drought, and that we can see a change in mortality when drought events occur, especially in the western part of the United States. We replicated that study in Nebraska just alone, and we found an increase in mortality in certain populations, especially rural areas, with major drought events that occurred. Populations between 45 and 65 years of age. But that was total mortality. We were interested in trying to better understand what was actually going on, underlying health issues that were related to drought events. So then that led us to the next study, where we got access to all the mortality records for the entire United States. And then we combined that with drought data to look for potential outcomes. Any state in red is where we saw an increase in respiratory related mortality in the US. Any state that's been identified is where we saw a statistically significant increase in mortality. As you can see, Montana, we saw an increase, but we didn't see a statistically significant increase in respiratory related mortality with drought events over about a 20-year time span. We dug in a little bit more deeply into understanding some of these relationships as well. With extreme drought conditions, we found more significant impacts, as you could potentially imagine, than more moderate drought conditions. We found that both males and females, men and women, both saw an increase in mortality associated with drought events. We actually saw women having more of a significant increase than men. Not by much, but a little bit more significant. We also found an increase in rural and urban populations, but rural populations more statistically significant increase in respiratory related mortality. So why? That was our first question. It's like, why? Well, we're still figuring this out. Why is it respiratory related mortality one of the issues that we're potentially seeing? Well, one, as you're probably well aware, living in Montana, we've seen an increase in fire activity. Droughts are associated with wildfires. Drier conditions can lead to wildfire formation. And we've seen an increase in wildfire season as well in the western part of the United States by up to over 78 days. I think that's a little bit of an older statistic, so it actually might be more since 1970. And the average duration of fires has increased by about 5-fold over the last 40, 50 years as well. One of the things that I want to point out is that when wildfires do happen, the impacts aren't just at the location where they occur. This is NASA satellite data across the United States. These red dots, which are maybe kind of difficult to see, it's where wildfires were occurring in Montana, Idaho, Canada. And as you can see, the smoke from those fires blew all the way across. And so this is back in 2017. You can find maps similar to this in 2018, 2020, 2022, 21, and then last year as well, where you saw air quality being impacted thousands of miles away from where the actual fires were occurring. And with that type of exposure, for example, Omaha, Nebraska, last year when those major wildfires were happening in Canada, we had bad air quality. We're typically not known for poor air quality in Omaha, Nebraska, but we had pretty much poor air quality for about 2 months, where we were hovering around the EPA limit for what air quality standards were. Which can have significant impacts in a variety of different locations. But then there's also another piece of this that we're still not understanding fully, which is that continuous or constant exposure that people are having, where if you're seeing more wildfires, it's not just being exposed at the time of that wildfire. What does it mean if you're being exposed 10 years in a row, 5 years in a row to wildfire smoke on a regular basis, especially if you have respiratory issues? Now, I'm sure you are all very well aware of this, but I'm going to use this as an example. And British Columbia, Canada, there were significant wildfires that were happening during the 2017 season. And I think it's a great story to tell in the context of the impacts it has, not just on from the fire into the communities, but also the impacts it has on healthcare as well. Those fires that were happening impacted 19 health facilities and sites in the region. It led to the evacuation of 880 patients. And then also on top of it, it caused displacement of 700 healthcare professionals. And so now all of a sudden you have a burdened health system, you have displaced populations, you have displaced people. You've seen it before. I know if like flooding has been a major issue around the Omaha area and how that's impacted healthcare workers, where all of a sudden, because of the flood events, people aren't actually able to get to the hospitals, and then the hospital becomes understaffed. And on top of it, you have a major event that's occurring that's causing more patients to potentially come in as well. So there are positives around the world that we live in. I don't want us to always think that we're living in a negative environment. And so one of the things that we can say is that we've seen a decrease in PM 2.5 and black carbon, especially in the eastern part of the United States, and even here to some extent in the western part of the United States as well. That's because our fuel systems are becoming more efficient. There's less industry as well, but our air quality has been improving over time. And the estimated number of deaths associated with air quality, that improvement in air quality has decreased as well. Back in, I think it was like the 1990s, early 2000s, it was estimated that about 100,000 people a year died because of PM 2.5 in the atmosphere. Those estimates are now down, I believe, around 60. So we're seeing improvements. But there's always a but, right? In the western part of the United States, PM 2.5 levels and black carbon have been increasing over time. And that's because primarily because of wildfires. More wildfire activity, more smoke, more PM 2.5, more black carbon. And also it's estimated in some of these regions that there's likely more deaths that are occurring because the air quality conditions are getting worse as well. That was a recent study that came out, I think, late last year, looking at these relationships. That was a NASA-funded study. Also, this isn't quite as much into Montana, at least right now. We're seeing more dust storms, especially in the western part of the United States. This is a work that me and some of our colleagues have worked on. Southwestern part of the United States, Nebraska as well, has been seeing more dust storm activity. And then that does have a potential impact as well, both on traffic accidents and also on potential respiratory health related issues. These red dots are fatalities associated with traffic accidents that are likely caused by dust storms. And so as you can see, there's even a couple in Montana as well. We recently published a study looking at other health outcomes. And one of the things that we found, we did a study that was focused on the Northern Plains, Northern Rockies, Montana obviously being part of that, as well as Nebraska. And one of the things that we first did was look at what is the exposure of severe drought conditions over from 2000 to 2018, which is our period of record for mortality data in this for the US. The dark red is where we saw more exposure to drought conditions. We then looked at what is that relationship with cardiovascular related mortality and total mortality. And we saw an increase in total mortality and cardiovascular related mortality with drought events that occurred over that 18 to 20 year period of record for this region. Populations that we found statistically significant increases was individuals over